All right, welcome back to another episode of the Doc Talk. And today we are going to discuss a topic that is often it's very difficult for both the parents, the patient, which is a young child, and the clinician. All difficult for all three parties in this case, and that is pediatric obesity. Um, this is a topic, as you know, Hira. Whenever we complete well child visits on our patients, and we typically monitor their weight year on year, or if we see them sooner. And then when numbers are showing begin to climb, then we often have to broach this topic about what's going on. We're noticing that year on year, the weight gain is more so than what should be expected at a normal level, and that can be a very challenging discussion to have with the parents, especially when it comes to someone's child. And myself as a parent, I completely understand. So today we're going to discuss pediatric obesity. We will give you some of the facts and hopefully, you know make a connection or open a dialogue or make things easier for you guys to understand, or for maybe the next time you see your child's pediatrician or family doctor, whoever you take them to. The If this topic comes up, it's not going to be as awkward of a process. So I'm going to open this up with giving you just a few facts. So according to the CDC, around 20% of children ages 2 to 19 are obese in the United States. That's roughly 15 million children in the US. And this number has tripled since the 1970s. Obviously, there are various reasons to this, but it's definitely on the rise. And today we will talk about a lot of different issues because of this. So, Hira, why don't you start us off
Hmm.
into this discussion?
Yeah. So I like that you brought up that it's an uncomfortable topic. I feel like for a lot of people, for adults, obviously, all the time as well, and for kids, obesity becomes labeled almost as a vanity topic. When people talk about obesity, it seems like, oh, it's about losing weight and looking a certain way and fitting certain body images. But really, what we hope to achieve today is to tell you it's not about that. It has nothing to do with vanity and how real the health implications are, and how early they start, and how sometimes out of a patient's control they can be. So there's three critical periods in your life where your fat cells undergo hyperplasia. Hyperplasia is multiplication, so where they just divide and multiply, and they two cells turn into 500 cells. That's hyperplasia. Okay. Hypertrophy is when one cell grows in size. Okay. So there's three key phases in your life where your fat cells undergo hyperplasia, so they're increasing in number. The first phase is out of your control. It's during the third trimester. So for every fetus, it's the last 3 months of pregnancy. The second phase is between ages 0 and 2. And the third phase is puberty. So what happens is, if a fetus in the third trimester is exposed to a lot of glucose and is exposed to a lot of insulin, which we see happening in mothers who have gestational diabetes, or women who are gaining a lot of weight during pregnancy, and
More than the
therefore,
recommended
yep, more than the
limit?
recommended amount that they should be gaining, and therefore are exposing the fetus to more glucose. So during that time period, your body is basically creating its fat cells, right? It's trying to figure out how many do I need to survive. And so all that exposure to glucose and insulin makes the body create so many more fat cells. So even before this child is born, it's already become more difficult for this child to avoid chronic disease, because this baby now has more fat cells than they should have.
So we are basically setting the stage at this point. What she's saying is the baby has to be birthed, come out to this world, and then inside the mother's womb it is protected. Everything is good in there, but when it comes out to the world, exposed to the elements, the environment, it needs to be able to protect itself. Thermogenesis, staying warm. So that's what she's saying. Everything is rapidly multiplying at that stage of the phase. So that's phase number one, and then
Hmm.
you said there's a second phase, age 0 to 2.
Yep. So between ages 0 to 2 is when you have the most growth in the human lifespan.
Mm.
So, a baby will triple in its weight from age 0 to 2. Okay. And so that's also the time where your body is rapidly growing. And so fat cells are rapidly multiplying. So babies who are exposed to a higher amount of calories than recommended during that first 2 years develop a higher risk of obesity and chronic diseases. Babies who are, breastfeeding is always better, obviously. A fed baby is best, so whatever you need to do, do. But breastfeeding exposes the baby to less glucose as well, so less calories, so formula can become a risk factor as well. And then babies who start solid foods too early. So if you're exposing a baby to solid foods at 4 months, then you're just increasing for how long the calories that they're exposed to. They're going to be exposed to more calories for longer and to develop more fat cells that way as well.
And remember, at the core of this, we are talking about creating more number of fat
Mm-hmm.
cells. Listen, once you develop a certain number of fat cells, there is no eliminating them. You are stuck with them for life. When people have weight loss, it is not that they're losing the number of fat cells,
Mm-hmm.
it is that the number of fat cells they have that are bigger, they're just shrinking them down so they look thinner. But that number of fat cells stays with you for life and it forever wants to grow.
Mm-hmm. And that's why these periods are so important, because you increase that number enough, and suddenly, if those cells increase even a little bit in size, it's going to add a lot more weight because you just have more cells there. So we want to prevent that from happening. And then the third period, like I said, was puberty. So during puberty, exact same thing. Your body is going through all these rapid changes, all these hormonal surges are happening. And so again, things are rapidly multiplying. So at this age, again, if you have a high exposure to glucose and high exposure to insulin, you're going to end up developing a much higher number of fat cells.
So very, very, very critical points in life that set the stage for the future adult. Remember, we're talking about pediatric obesity here, but we are also, we also like to point out the fact that this child eventually is going to become an adult, and
Mm-hmm.
we know right now in 2025 obesity is at an all-time high, diabetes is at an all-time high, hypertension is at an all-time high, sleep apnea is at an all-time high, heart disease. I mean, I can rattle off a list of diseases that is at an all-time high. People often like to say, you know uh, in social media and stuff, that we don't usually go after the root cause. What is the root cause of the problem? Don't just treat the symptom, just figure out what the root cause is. And today we are discussing with you guys what the root cause of all these adult diseases is. It starts in childhood. We need to focus on this.
Mm-hmm. And so another important thing for people to know is that fat cells or adipose tissue is not just tissue that just sits there. It's metabolically active tissue. What that means is that it actually makes changes to the body and to things that happen inside the body. So adipose tissue releases these two chemicals called TNF alpha and IL-6, and basically what they are is just inflammatory chemicals. So their job is to cause inflammation. Okay, and so just by the presence of those adipose cells, you're now creating more inflammation in the body. And when you create more inflammation in the body, you increase the risk of chronic diseases so much more.
And this is where the things gets really interesting. I'm not ashamed to admit this. I've been through medical school and residency, and now I'm almost like 2.5 years out of of the residency. And the learning never stops, by the way. But my God,
Yep.
this was a huge shocker to me.
Mm-hmm. The
Childhood
actual
obe-
numbers.
yeah,
Yeah.
crazy. Childhood obesity uh, raises the risk of MS almost to like 50% or something like that. I think I was reading earlier.
Yeah.
We're talking about autoimmune diseases, okay? So, autoimmune disease is when the body starts to attack its own self because it doesn't recognize it anymore. What she was talking about with the fat cells, the adipose cells releasing these inflammatory cytokines, these markers, that is what confuses the body, because now the body just gets confused and it starts attacking itself. So rheumatoid arthritis is an autoimmune condition
Mm-hmm.
where the joints, get attacked, inflammation. We're talking about lupus, some psoriatic conditions. So all of this is stemming from obesity. And what is obesity? This term obesity has gotten in the media it has been talked about so much that now it's almost a negative connotation. Obesity is a medical term, my friends. It's a medical term. It's not a derogatory term, you know. It's what us medical professionals use in order to help classify, you know. And we don't use these diagnoses on your charts or talk to you about this to poke fun, or we are judging you that you're useless and you don't have the willpower, the motivation to stay fit. No,
It's not a label.
it's not. It's
Yeah.
not a label.
It's a diagnosis.
We have that on there so that
Yep.
we can understand what we're dealing with, because your management of your care of your health is going to be totally different if your BMI is 50, which is really elevated, versus a BMI of 25, which is still considered overweight, but it's much healthier. And that, helps us think differently. How aggressive or not do we get with your care?
Because in the person who has a BMI of 50, if they're coming in with joint pain, you have to understand that their risk of autoimmune disease is so much higher, and so your threshold for, okay, when do I test them for an autoimmune disease, is much lower. You're going to test that person much faster, and so it's important to be able to use that in order to benefit the patient and figure out, what testing they're going to be more in need of.
That's correct. So that was a little sidebar from the pediatric obesity. I'm
Hmm.
sorry I took a little tangent.
Yeah.
Sometimes, when I get passionate about something, I like to just get it out.
Yeah.
So now back to the topic at hand. So yeah, it raises a lot of disease processes. Autoimmune conditions stem straightly can come from childhood obesity. You know, diabetes used to be called adult onset, but believe it or not, now we are seeing type 2 diabetes mellitus in ages 8 to 10. It is
Hmm.
absolutely heartbreaking to see young children with this condition, because you have to realize that diabetes is a condition that is high glucose, and glucose destroys everything in the body: the nerves, the eyes, the kidneys, skin, I mean, brain function, everything, right? So if you have a young child age 8 to 10 who has already developed type 2 diabetes mellitus, my goodness, this individual is, if not well controlled, his adulthood is just not looking too great.
Hmm. Yeah. And so, what can we do about it? We know that it's a problem. We know that it's increasing. We know that there's tons of things in society and in the food that we eat that are contributing to this. And a lot of them are out of our control, Food prices are rising and healthier food is more expensive, and fast food and processed food is easier to get. Kids are more and more dependent on screens for schools, for education, for entertainment. There's much less physical activity, outdoor time is just much less. There's safety issues. So what can we realistically do about this? Because the truth is that we do need to do something.
So something definitely has to be done, right? So first, I would like to start off by opening a line of communication as two physicians. Okay, today I we are looking at you guys, and we want to open a line of communication and help you understand that when we bring up this issue with you guys, please understand that we are not judging you, we are not labeling you, nor your children. We want what's best for them. When we take you guys on as our patients under our panel, we take that responsibility seriously. We want you guys to do well. If I'm your PCP, your primary care provider, heck yeah, I want my panel to be healthy and everybody doing well and living great, right? So that's step number one. We want you guys to just trust and believe your physician, your doctor, when they bring these things up. Number two, let's do some actionable things, right? So that we can get things started here. Physical activity first and foremost. Remember I told you 1970s, it's tripled now.
Hmm.
What has happened, right? Technology, we're moving less and less. Smart cars, I mean, my gosh, cars are driving themselves. So activity level has gone down. So 60 minutes of physical activity per day. No, we are not going to be prescribing you what the adults, what we prescribe adults, 150 minutes of moderate, vigorous activity. No, no, no. In children, if you can get 60 minutes of actual physical activity per day, that's a great place to start off from.
Hmm.
Okay. What else can they do?
Yeah, and making that physical activity entertaining. It doesn't have to be regimented exercise. It can be playing tag. And I think this is where the hardest part is, because in order to make a child engage in these positive behaviors, physical activity, and then we can talk about nutrition as well, the adult has to model that behavior. It's very difficult to tell a child, hey, I want you to get up and, run around the backyard for 10 minutes while I sit over here on the couch and watch TV, right?
That's absolutely correct.
So it's hypocritical. It can make the child feel bad about themselves, like there's something wrong with them, and that's why they have to do this activity, but the parent doesn't have to do it. It's not good for you. You should be moving around too. And it's not sustainable. You know that the truth is that behavior is not going to be repeated by the child very often. They might do it initially because you told them to, or they're scared they're going to get in trouble, but they're not going to sustain that behavior. So you're not going to make positive change with that.
It's a group effort, hands down. So move 60 minutes per day,
Mm-hmm.
and you have to participate. That's non negotiable. You have to participate. I mean, it's just not going to happen if you
Yeah.
don't. Because, like she said, it is unfair. Think about your child. Why would they want to do this? And no corporal punishment, and I'm your dad and I said so. Yeah, none of that stuff works, okay? Keep in mind, we are trying to raise healthy adults over here. So, you trying to corporal punishment way and be that overbearing
Mm-hmm.
individual to force them into it is not going to work. So, you have to partner.
Yeah.
And now that moves us into nutrition. Again, the partnership piece does not end here either. Do you really think that you are going to tell your kids that you cannot have ice cream or XYZ while you're over there having a donut? I'm sorry. Does not exist.
Yeah. Yeah. If you don't want something to be eaten, don't bring it in the house. You know, if your child has trouble with snacking, and I mean kids will, right? Because their front prefrontal cortex hasn't developed. They can't make the actual smart choice of, hey, if I'm going to eat chips, I'll eat only this much, or I'm only going to eat the snack once a week. If it's in front of them, they're going to want it. So if you don't want your child exposed to certain foods, don't bring them inside the house. You know, treat treats like actual treats, not an everyday thing, right? So once a week we eat out, or once a week we get ice cream, or whatever the schedule is that you want to set. And then whatever you set, you follow it as well. You know, again, just like physical activity, it's good for you. You should be doing it too. And also, it's hard to enforce a behavior that you're not modeling. So you need to model that behavior yourself as well. You know, um, and it doesn't have to be, mean or harsh. You can just bring healthy food inside the house. Make sure that their plate has all the colors on it. If your kid is asking for a second serving of food and you feel like they've had a good serving, make them get up and say, go ahead and wait for 15 minutes, go do something else for 15 minutes. And if you're still hungry 15 minutes later, come back and we'll eat.
That is key.
Mm-hmm.
If there's nothing else that sticks today, if you can make this one change starting tomorrow, believe me, you will see a huge change. Let them finish their first serving and just wait that 15 minutes. Just wait it out. They
Mm-hmm.
can sit at the table, wait it out. They can go for a walk, doesn't matter.
Because
I
that's
guarantee you they will not want the second after that 15 minutes.
Yeah, because it's chemically important, right? Because your stomach has to send signals to your brain to say, okay, I'm full. But those signals don't just rapidly go to the brain, right? Especially not as you're eating, okay? You have to give time for those signals to go from your stomach to your brain to indicate fullness. And so that's why those 15 minutes are important, because by that time, the brain now feels full. And so the child doesn't want the second serving anymore.
So, yes, so there's a lot more that can be talked about this topic, and we hope to do a future podcast to explore this even deeper. But one thing I would just like to say is that there's always a lot of individuals, and I love questions when my patients bring or challenges. I love to talk about that kind of stuff. So we understand the limitations of BMI. We understand all that kind of stuff. When we assess obesity or overweight, we are not just looking at one number. Okay,
Mm-hmm.
we are clinicians. We did study the human body. We are looking at everything. Okay, so no, we are not just telling you, hey, the BMI is crazy high, and yeah, you got a problem. No, it's the whole global picture. So we are respectful of those parameters, and when patients have questions about that kind of stuff, I love to engage and we talk it out, and it's usually a
Mm-hmm.
good discussion.
Yeah.
So yeah, if you can move 60 minutes, you have to partake with your children in the exercise and in the eating healthy. That's non-negotiable. I mean, you have to. There's no other way around it. Okay. And then now in a future podcast, we can, you know, talk more about how the neurobiology of this thing is similar to addiction, that kind of stuff, epigenetics. There's a lot to discuss about pediatric obesity. But I think we've done
Yeah, this
a
is a general overview, and then we can
yeah.
break it down further. Yeah.
Okay, very good. That's it. See you guys next time.